There aren't any muscles in the hand, per se. There are some smaller muscles in between the small little bones in the hand, but any of the motion that occurs within the hand is based on muscles that are in the forearm. A muscle then turns into a tendon, which is sort of a rope-like material. The muscle turns into a rope. The rope then continues in a very specific ways throughout the hand, and the tip of the rope attaches to the bone. When the muscle pulls the tendon, it's going to bend the fingers. Why doesn't the tendon bowstring like that? The reason it doesn't is throughout the path of each of the tendons, there is a sheath. Sorry, I just found this morning. Tendons go through various sheaths along the path. So the sheath prevents the tendon from bowstringing. Now, a lot of motion occurs between the tendon and the sheath. The inner surface of the sheath is lubricated with a combination of fluid and almost like oil and grease to allow for all this motion to occur. As we make a fist, the long tendons have an excursion of between 5 or 6 centimeters. With the thumb abducted and extended, the one major sheath is right here. And if the tendon goes through the sheath and there's a bit of an angle to it, as that begins to move, the tendon starts to get a little bit irritated. And the tendon can, in extreme circumstances, begin to fray, as this frayed as I cut it here this morning. And that has to undergo a healing process. Luckily, most of the time, biology is able to heal quite well. But the tendons are not a very well blood supplied part of the body. So it takes a little time for all of the healing cells to come to work. But that's basically what tendinitis is. Inflammation of the tendon along this path, or tenosynovitis, is inflammation in the inside of the sheath. So de Quervains was the first one to kind of describe this phenomenon, specifically where the tendon sheath right here at the wrist, where the two major tendons that abduct and extend the thumb become problematic. And that has been termed de Quervains tenosynovitis.